What is permanent supportive housing? In 2006, Malcolm Gladwell wrote an article for the New Yorker magazine about a man he called Million Dollar Murray, a veteran who was homeless who, over the course of a decade, had run up $1 million medical bill in hospitalizations, substance abuse counseling, and the like. It cost more money to ignore Murray than to provide housing and support services. As Gladwell wrote, solving homelessness is less expensive than managing it. As we say, homelessness is expensive. We should invest in solutions. Connecticut has million-dollar Murrays as well. About a third of Connecticut's homeless are considered chronically homeless, like Murray. The federal government considers a person chronically homeless if that person has experienced homelessness for a year or longer, or has experienced at least 4 episodes of homelessness in the last 3 years and has a disability. A family with an adult member who meets this description would also be considered chronically homeless. For many of the people who are chronically homeless, housing must include supportive services, such as substance abuse counseling or mental health services. And even providing all the services they need for as long as they need it is still less expensive than ignoring them. Homeless shelters? Vital in the short run, but shelters are not designed to offer long-term solutions. Permanent supportive housing? Far cheaper in the long run with better outcomes for the residents. So we can address the issue the more expensive, less effective way, or we can build permanent supportive housing and house Connecticut's million-dollar Murrays at a huge cost saving. Partnership is part of an innovative program, Connecticut Fuse, that targets a small set of people with complex unmet needs that make housing challenging. With the proper services, however, these residents can be housed and given supportive services for far less than it costs to ignore them, and they tend to stay housed. Connecticut has 5,758 units of supportive housing, but we need 1,400 more units to end long-term homelessness. Contact your legislators. Let them know we intend to end chronic homelessness. It is entirely doable.